As part of efforts to improve the health sector, the Association of Medical Laboratory Scientists of Nigeria is calling for the use of locally made vaccine as a way of totally wiping out epidemic in the country. The association tasked the federal government on medical surveillance over the reoccurrence of diseases earlier declared as eradicated.
Several of our gatherings, we have addressed our concern on the need for local production of vaccines, because vaccines produced using local strains tend to be more potent than those imported vaccines. So it will be more protective if we use strains produced locally to ensure that these vaccines are protective. We will not be having reoccurrence of yellow fever, reoccurrence of meningitis, Lassa fever, and all those things.
Before now, vaccines are usually given, for 10 years period, because the antibody is is expected to last 10 years. But there's supposed to be continuous surveillance to see whether these even vaccines are potent and whether these diseases are still available within an environment. So because there is failure of governments to support, and ensure that this surveillance, proper surveillance is being done, on various diseases, we have emergence and re-emergence of, diseases, that unfortunately should have been handled, without any hoods.
The association has also thrown its weight behind the strike action embarked upon by the joint health sector unions, JOHESU. President of the association, Toyosi Rahim, said at a meeting held in Osogbo, the Osun state capital, that the ongoing national JOHESU strike will receive the blessings of the association.
We have resolved at this special general meeting that members of our association will actively participate in the JOHESU initiated national strike. And it is not in our character to call our members to join strike. But I think this is the only option that government seems to understand.
The association also pushed for employment of more medical laboratory scientists, as well as compliance with court judgment, which has given its members professional autonomy across health facilities in the country.